Hey guys, I'm back 1 week out, and I'm happy to report that I'm alright. Everything's good. Not in pain. Everything's fine. Thank God. I had to write down some notes about what I was going to talk about because my brain was just everywhere. There's just so much to really talk about, and like so many experiences, so many things I've learned this past week about myself, about my new sleeve, about surgery in general. But I'm not going to talk about everything. I just highlighted a few things. So let me just start out by saying that I'm happy with my weight loss this past week. My highest weight ever was 275, and the day I was weighed at surgery, I saw on my discharge papers they weighed me. I was 244, and I weighed myself today, and I'm 234. So I'm only counting weight loss since surgery, because to me, that's what counts. And that is a 10-pound loss in a week. And if you're losing 10 pounds without surgery, you need to call your doctor, because that's not right. The next thing I have listed as what I need to talk about or should talk about is the hospital experience. Oh my gosh. Okay, so I'm gonna just say that overall it was a good experience because the 3 nurses I have, the unsung heroes of the hospitals, Frances, Michelle, and Tamika, were outstanding. Best I've ever had. However, there was a problem. When I was in recovery, which is the place you are right before they take you to your room, where you're going to be for the rest of the few days you're there, I was maybe about 2 hours post-op when they were taking me out of there. And it was 3 nurses. Yeah, it took 3 nurses to transport me from recovery over to the ASU. And while they were transporting me, they couldn't get the damn bed, which was, I guess, like semi-automatic or whatever. It's supposed to, like, help them a little bit. Like, it's not just wheels. I think it also has a motor. And they couldn't get it to work because someone literally forgot to charge it last night or the night before. So they were like shoving and pushing and like getting, like, just making all weird grunting noises, and the whole time my whole body was just jolting and jerking the whole time on the stupid bed. And when they would take corners to, go do, obviously take a corner, they kept bumping my bed into different corners of hallways and like bumping my bed into doors and all this stuff, and it was painful. I ended up getting ugly and cursing them out right then and there. People, like traffic in the hallways, nurses, doctors, patients, I just cursed them out with me in the bed. The worst is they realized, okay, let's give up on this bed and let's get her a different bed, like just a regular standard bed on wheels. They bring it, and then they're like, okay, move yourself. And I was, like I said, 2 hours post-op. I did not want to move myself. Everything was painful at the moment, and I was like, I can't move myself. They're like, well, you're gonna have to try. With like this awful attitude. And I did. It hurt, but whatever. It was over in like a minute. I was in my room and they were gone. But that was retarded. Excuse me, that was really stupid. And that was just a brief moment out of the 3 days that I was there. Everything else was wonderful. The hospital, by the way, was Memorial Hospital, the University Hospital in Savannah, Georgia. The next thing I have to talk about is what am I eating? And I brought over this here. It's Premier Protein, 30 grams of protein, 160 calories, 1 gram of sugar, really low fat, and it's just got all these vitamins and minerals that we need, and it's got 5 carbs for the whole container, which is great. I cannot say how hard it is actually to stay hydrated and to stay up on protein. I'm doing a horrible job, if I'm honest, this first week. I'm gonna probably tomorrow buy some unflavored protein powder from wherever I can find it, because there's just no way. The only way I could possibly stay up on my protein would be if I had like 3 of these a day. The problem is, one of these lasts me for like 3 meals, like 2 to 3 meals, depending on how I'm feeling. I'm also having like Campbell's cream of chicken or cream of mushroom made with skim milk or water, and one of those cans can also last me between 2 to 3 servings. And just trying to like wait the 30-minute period between eating and drinking and then eating again. You know, it's just hard to really 64 ounces minimum. If I drink too fast, and I'm sure like other post-oppers will tell you this, especially those who are 1 week out and stuff like that. If I drink too fast, you know, it hurts. Like there's this awful pressure, like right at the opening of the stomach is what it feels like, and you know, you just burp and you hiccup, and it just like feels like this awful like spasm like that of the stomach, and it just hurts. So you have to really sip, you know, small sips, wait between sips. I've had to learn that the hard way this past week. So yeah, that's that. I'm in no pain. I would say that I had no pain from the surgery probably on day 2 or 3. There was pain, but it was because of gas, which they, you know, the gas that they use to inflate your abdomen in order to go in and look and to perform the surgery. You have to literally pass gas to get rid of that. You have to fart. You have to fart it out. And, you know, you're not allowed to push it out. You have to just wait until it's like there and like ready to come out. A body shot. Oh god. Next thing I wrote was body shot. Okay. Here it is. So, I put my body shot there, and god, this is awful, but here is the front. This shirt actually didn't fit me, and now it does, which is nice. And here's the sign. Terribly depressing, but that's all gonna change. Anyway, thanks guys for coming and checking my video. Please comment and subscribe, or just message me or anything. I would like some support from the YouTube and obesityhelp.com community. Any kind of encouragement, you guys, would be great, because I just feel alone in this a little bit. Thanks guys. See you next week.